The Canadian Press, please go ahead. Your line is open. La parole est à vous.
Good afternoon. Dr. Tam, just picking up on what you talked about with children going back to school in many parts of the country today, can you just talk about what are some of the signs or signals that you may be monitoring to see if, as far as caseloads, as far as that back to school plan goes, what will you be monitoring to see if we are on a best case trajectory, and maybe what we should be looking for to see if that trajectory is heading in the wrong direction?
Yes, so as I've said, that it's important to keep the community transmission at a manageable level if you don't want to see cases in a school or, in fact, the potential for actual transmission in those settings. So I think some of the key indicators which we've been monitoring for some time is not just the daily number of cases, and they go up and down, and sometimes people don't report at the weekend, sometimes they, so today we expect to see some of the numbers go up, is that we're looking at the number of cases averaged over the last week and really looking at the trend and to see how fast those numbers are increasing. We also have to look at who are impacted by COVID-19 at any given moment. We know that in the last days and weeks, it has been younger adults, the sort of 20 to 29, and then the 30 to 39-year-olds. And so because they are increasing their mobility, getting back to work in certain circumstances, that's important to watch for, because any public health action is dependent on knowledge of which demographic, which group the public health action should be targeted at. I think we're monitoring the kinds of outbreaks and the numbers of them. So what has been evident and a bit different from in the first wave at this point in time is that there are still long-term care facility outbreaks, and they are and cases in them, but they are now much smaller than the previous wave. And so I hope that's a sign that we've learned something about protecting those highly at-risk settings. But we have to watch that really carefully, because again, the acceleration in transmission and acceleration in severe morbidity and mortality will be if there's a shift in that into those high-risk settings. I think what we need to see when I said we're looking at the kind of outbreaks is that what you don't want this virus to get into a setting where the high degree of transmission, sometimes called super spreading events, can occur. Those sort of crowded and closed environments where people are gathering and where they're not observing public health measures, or where you have to help them adjust their protocol so that they can better manage. And so, but the most difficult part, I think, and that we're watching for in the kinds of outbreak is the fact that there are private functions and family gatherings where we need to, make sure that we support every person in this country to know what to do to minimize the risk, like reducing the number of contacts. So all of those things are more the epidemiologic parameters. And we've been monitoring, as you know, the reproduction number, which is the RT, so seeing where that is going. That's going up and down. It's now, I think, at the national level, because of what's happening in the larger provinces, is hovering above 1 now, which means one person is transmitting to over one person, just over. That is not a good sign. Don't want that to happen. So that has to be monitored very carefully. The other signals of potential for acceleration of transmission is sort of the turnaround time of the public health systems, contact tracing and testing. So we're asking for provinces to see if they can give us an idea of how they're doing, because that matters in breaking chains of transmission. And public health can't do their jobs unless people present for testing and present for contact and support contact tracing. So it's quite a complex piece, but the bottom line is we know what has worked, and we really have to keep applying that in the current context to keep transmissions low. So this week, I think, is a really critical week, and so for sure next week, because then you would have had some idea of what happens when you go back to school. So the next couple of weeks is 2 weeks of careful vigilance.